Hi, my name is Sarita Sigdil, and this is a presentation on Case of Change, where the case of change is teamwork nursing. This is the final presentation of SMAH 917. Talking about the introduction of this case of change, we all know that the demand of healthcare has been rising and shortages of nurses has been a vexing problem worldwide. In Australia, challenges such as time constraints has impacted on nurse-patient interactions and caused missing nursing care. Most common causes of incomplete nursing services are inadequate resources, unexpected rise in the patient volume, and tension and breakdown between the medical staff. Job dissatisfaction is reported to be strongly associated with nurses giving up the job and intend to leave the profession. Teamwork nursing, however, has been reported as one of the components that prevents nursing care being missed, reduces errors, and increases performance. Talking about the reason for change, our ward is an acute aged care ward which requires maximum nursing care, such as showering, feeding, toileting, and repositioning. Um, Teamwork makes these nursing care easier and improves the patient outcome. For example, ambulating repositioning incontinence care becomes easier and effective in teamwork. And the change in the current practice in our ward, where we are practicing individual nursing, the change is required because of the increasing patient volume, increasing demands, workloads, and increasing needs for elderly patient. Changing rules and policies is another challenging factor. In the past few years, there has been sorry, there has been increment in compulsory documentations which requires a certain time from the working hour. This impacts the nursing care and patient relationship. At such time, team nursing is essential to divide and delegate the task. Now, justification of the chains model. ADKAR model will be used to introduce team nursing. ADKAR comprises of awareness, desire, knowledge, ability, and reinforcement. This model will be used in this case because this can be applicable to make a successful change from one person to a whole healthcare organization. This model is simple, provides clear goals, and can be easily understood by all staff. The leaders and change management team focus on driving individual change in this ADKAR model. Now, talking about the five components of ADKAR model, the first component is awareness. The manager will first assess the awareness of the problem and understanding of the importance of change. Effective communication and access to information are key for the awareness phase. Second phase is desire, where there should be a desire to bring changes in manager and the staff. The readiness of nursing staff makes them more involved in the change process. Participation of people in the change projects reduces resistance rate, and the process of change is accelerated. In order to improve or sustain motivation, the manager should set the context right and explain the clear a role clearly to set expectations from staff. The third component is knowledge, where resources, adequate time, and timely feedback should be provided. Formal face-to-face training, online courses, mentoring, and coaching about team nursing should be provided as required. Education should be provided to all the nursing staff, medical staff, and health staff, allied health staff to enable an effective implementation. This increases participation of the staff in change process. Um, the second last component is ability, where the capability to take up the role and responsibilities of the job will be assessed. Additional resources, training should be provided as required in this phase. Coaching and mentoring can be helpful to build abilities. So the last component is reinforcement. The change practice should be reinforced with a strong contribution from the manager and the senior nursing staff to create its sustainability. Talking about the skills required by leaders and change agents, research has shown that the delivery of organizational change projects requires a diverse range of skills. Onboarding to a new change requires understanding of the individual abilities. The leader needs to understand that not everyone learns and adopts at the same pace. Hence, it is necessary to have flexibility and customization as per the requirements of the staff. The leader should have ability to teach and mentor, be respectful, warm, and approachable. The change agent must be accountable, responsible, and flexible during the change process. So communicating to stakeholders about the case of change is another important factor, important component of the change process. Um, Healthcare integration is an effective method in coordinating activities in organizational departments. And balancing stakeholder viewpoints is a critical key to success. So, appropriate media will be selected to communicate with the stakeholders. So, in our case, email, online presentation, face to face presentation would be the most effective method of communication in healthcare. The barriers and enablers for this change process would be failure to understand resistance to change, failure to define role and responsibilities, inability of managers to implement a care strategy, a failure to execute change strategy, and the other one is organizational change projects that may place significantly different demands on the people managing them. Likewise, disruption from the opposition side will be managed. So disruption from the opposition side, or the one who resist to change, will be managed through communication, awareness, and education. All the staff who recognize the importance of the change and participated in the change process will be the enablers of this change process. Next is evaluation phase, where the evaluation will be done to understand whether the change process has been implemented successfully. Change always involves some degree of growth in people, personal confidence and competence, and we found that the journey differs from each person involved. People have different feelings and perceptions as the change process unfolds. Thus, it is essential to evaluate whether the change process has been implemented successfully. The change process in this case of change will be evaluated through observation of the new practice and change in the patient outcomes. Interview would be conducted on staff and patients. Survey could be done to know if the change has been effective. The successful indicators of the change would be positive patient outcome, shortened hospital stay, positive feedback from the patient and visitors, effective nursing care, decreased pressure injuries, and great communication skills between the staff. So these are the references that I used for my case of change presentation. Thank you for your time.